Hello, I'm Dr. Larry Hanus. I'm a general dentist in Iowa City, Iowa. In our practice, we emphasize holistic, biological, and alternative dentistry. What that means is we consider the relationship between your oral health and your overall health in general. This PowerPoint video is on Dental Mercury Amalgam Fillings. These fillings have been used for many years in dentistry, but currently there's an increasing controversy surrounding them. You'll be now watching one of two PowerPoints. One is an introductory version and one a comprehensive version on this subject. If it piques your interest, please feel free to view our website, iowamercuryfreedentistry.com. That's iowamercuryfreedentistry.com. Thank you. This is Dr. Larry Hanus, and I'd like to welcome you to our comprehensive PowerPoint on Dental Mercury Amalgam Fillings. Dental Mercury Amalgam Fillings, which contain and release dental mercury throughout their lifetime, have been used in dentistry for many years. Currently, the use of dental amalgam fillings has become controversial. What is dental mercury amalgam filling? According to the FDA, this is a mixture of metals consisting of liquid mercury and a powdered alloy of silver, tin, and copper. This contains 50% mercury by weight, and it's also known as a silver filling because of their appearance. What is the concern? The concern is whether dental mercury amalgam poses a risk to your health. The FDA and the ADA opinions are diverse from the scientific research that's contemporary and currently available. So this results in confusion. The ADA says no studies have been published demonstrating systemic adverse effects from amalgam restorations, and the small amount of mercury released, especially during placement and removal, has not been shown to cause any adverse health effects. However, according to the ADA statement, there are no studies. The current literature available shows that studies among multiple age groups in different countries around the world indicate something quite different. The Lancet, the prestigious British medical journal, states that findings suggest use of mercury as a restorative material is a health risk for dentists, and another study indicates a dentist's occupational exposure should be considered a justification for reduced amalgam risk. In a study on human infants, there was demonstrated a positive correlation of mercury milk levels with the number of the mother's fillings, and that this poses a threat to the health of these nursing infants. Another study tells us that amalgam contributes substantially to the human mercury load, accumulating in some organs, particularly the brain. It relates that to a number of different health conditions, and finally it states the available data suggests amalgam is an unsuitable material for medical, occupational, and ecological reasons. The World Health Organization states that the mercury contained in dental amalgam is the greatest source of mercury vapor in non-industrial settings, and that those levels significantly exceed those set for food and air. And recent studies suggest that mercury may have no threshold below which some adverse effects do not occur, which means there is no safe exposure level to mercury. And you can view on the IOMT.org website or the site listed below a video called The Smoking Tooth, which demonstrates that even after 25 years you can still expect mercury vapors to come off of these dental amalgam mercury fillings. Is dental mercury amalgam safe? Well, it depends on who you talk to, maybe or maybe not. The FDA says it is safe because it's been used for 150 years. The World Health Organization urges a switch away from dental amalgam and determines that amalgam continuously releases a significant amount of mercury, which raises general health concerns. What about the ADA? In a 1992 petition to the courts, plaintiff Tolhurst alleged that his health conditions were related to the mercury coming from his dental amalgam fillings, and he further alleged that the ADA and several others were in fact liable for his injuries. Well, the ADA filed a motion with the court stating it owes no legal duty to protect the public from allegedly dangerous products, and the court agreed with the ADA and dismissed them from that lawsuit. Remember, the ADA owes no legal duty to protect you. The ADA is not a government agency or a public health organization. It's a private trade organization representing the interests of its membership. What about OSHA? Well, if a dentist has employees, then he must or she must comply with OSHA regulations. And these define mercury as a hazardous chemical, and that the workplace must be safe for employees exposed to that mercury. What about the EPA? Well, the United States has become a signatory to the United Nations Environment Program at the Minamata Convention on Mercury. In preparation for that, the EPA worked closely with the State Department and others, and this requires the signatories to phase out or to take measures to reduce mercury use in certain products and create initiatives to reduce the use of mercury in dental amalgam. What about a recent Zogby poll? Well, a recent Zogby poll found a majority of Americans aren't aware that the neurotoxic mercury is the primary ingredient in these silver fillings. Nearly 1 in 4, or 25%, believe that silver actually is the primary ingredient. And only about 1 in 10 of Americans report ever being told the truth by their dentist that amalgam fillings are mostly mercury. And it goes on to say that 2/3 of the respondents believe their dentists do not provide them with enough information about alternatives to make informed decisions. What about consumers for dental choice? Consumers for dental choice, based on the Zogby polls, tells us that the majority of Americans want government action to stop the marketing of mercury dental fillings using misleading terms like silver. In spite of this, the FDA's official policy on dental mercury is to actually advocate for its increased use. What are the alternatives? The most common alternative to mercury amalgam fillings is called a composite filling. It's a tooth-colored material made of plastic or acrylic, and it contains small glasses of ceramic materials to provide strength. It's hardened with a light when it's placed in the tooth. And since composite fillings bond to the tooth, they actually can restore most of the original strength of the tooth, where amalgam weakens the tooth, making them more susceptible to breaking. Again, the amalgam makes the tooth more susceptible to breaking. The composite adds significant strength. What about strength? Dr. Harold Lowe, the former director of the National Institute of Dental Research, says, the first filling is a critical step in the life of a tooth. The amalgam requires removing a lot of the tooth, diseased and healthy as well, sacrificing a lot of the tooth, resulting in a weakened tooth. And the tooth breaks off and you need a crown. And on the right you see a clear example of this. Dr. Lowe went on to say that new materials, the composites, bond to the surface of the tooth, and you can remove little additional tooth to get an adequate restoration. And the pictures below show the same teeth on the left with amalgam fillings and on the right after they've been replaced by composites. What about cracking your teeth? As amalgams age and corrode, they expand, which stresses the tooth. Also, amalgams are made of metal, and so when you have something hot to eat, the amalgam expands, and the tooth does not expand to that same rate. So it's like running hot water on a jar lid to loosen it. But here it's as if the lid is inside the jar. Whenever anything hot gets on it, it slowly tends to crack the tooth. And in the photos below, you see multiple cracks which result in fracture, damaging the tooth and injuring the gums. On the left, you see cracks between the fillings and a crack on the back side of a filling. On the right, you see the back corner has broken off, damaging the tooth and injuring the gum. In the photos on the right, you see in the upper an amalgam filling placed with cracks coming from around it. In the photo below, after the amalgam is removed, you can see the cracks actually penetrating and going through the entire floor of the tooth. So the entire tooth is susceptible to splitting or cracking. Are composites really stronger? Well, 2 prestigious clinical dental journals tell us that the results show no difference existing in the rate of replacement for amalgam versus composite, and they tell us that restorative materials chosen are not associated with the longevity of the restoration. Are there benefits to amalgam removal? Well, the Journal of Dental Research says that there was a considerable decline in the mercury levels of blood, plasma, and urine, which approached those of the subjects without any history of ever having amalgam fillings, following the removal of the mercury amalgam fillings. They go on to say another study shows that after removal of amalgams, 9 of the 10 subjects exhibited a statistically significant decrease in blood mercury. What about the dentist? Well, according to research, dentists demonstrate significantly more prescription utilization of specific illness medications than controls, which places them at greater risk than the general population for those disorders, as well as threatening the future health of America's children and adults who continue to receive these amalgam restorations. What about dental staff? Well, the Swedish Dental Journal shows that the results revealed a high mercury correlation or concentration in pituitaries from the dental staff compared to controls. And another journal tells us that the dental staff in this study had a higher blood and urine level than a control group. So according to this research, in fact, dental staff are at risk to the mercury in these fillings. Is it safe to remove amalgam? Well, this is a good question. Thousands of amalgam fillings are replaced every day because of normal wear and tear or fracture of the filling of their tooth. Unfortunately, much of the time, there is little or no consideration given to mercury vapor exposure to the patient or to the dental staff. Mercury-safe dentistry would typically involve consideration of both the patient and the dental staff and would include patient airway management, room air management, rubber dam, and other precautions. An aerosol that contains amalgam particles is created when a high-speed handpiece or drill is used to remove amalgam restorations. And these particles, smaller than 10 microns, are fully respirable or can be breathed into your lungs. And so it's therefore recommended that all dental personnel wear face masks while removing existing amalgam restorations, and be mindful of the fact that the typical paper face mask will do virtually nothing to protect you in this circumstance, and so a respirator is indicated, as you see in the picture above. Aspects of safe amalgam removal might include utilizing an efficient suction system, utilizing a nitrile or rubber dam to protect from breathing mercury vapors, operating a vacuum system at maximum efficiency, applying copious amounts of water to the filling during removal, and using a slow-speed drill to minimize the particles that are generated, and providing the patient staff with a mercury-free source of air, which could include filters or high-capacity evacuation fans. The International Academy of Oral Medicine Toxicology's statement says, "The risk of illness or injury associated with the use of dental mercury presents an unreasonable, direct, and substantial danger to the health of dental patients and the health of dental personnel." They go on to say that dental mercury amalgam fillings should not be used in dentistry. This is an organization of dentists, physicians, and researchers opposed to the use of dental amalgam fillings. Thank you for viewing our PowerPoint. For more information on our office or dental subjects, please feel free to visit our website, iowamercuryfreedentistry.com. That's iowamercuryfreedentistry.com. And you may also contact us at 319-512-5655. That's 319-512-5655. Thank you very much.